Hi everybody, I chose to do my presentation based off of the article on page 228 of the text called Global Enemies of Health, the Double Burden of Low-Income Nations. And the article basically talks about the burden of the health issues in low-income nations and some of the causes and kind of comparing the burden of the health risks between low-income nations and high-income nations. And the article starts out by listing the top 10 causes of death and health and reasons of health risk in low-income nations, which are underweight children, high blood pressure, unsafe sex, unsafe water, sanitation and hygiene, high blood glucose, indoor smoke from solid fuels, tobacco use, physical inactivity, suboptimal breastfeeding, and high cholesterol. If we look at World Health Organization's top 10 list of health risks for global, they are heart disease, stroke, lower respiratory infections, chronic obstructive pulmonary disease, lung cancers, diabetes, Alzheimer's and other dementias, diarrheal diseases, TB, and road injury. If you compare the two, you'll notice that the global health risks are more so from non-communicable diseases and things that may be caused by diet and lifestyle. And the low-income nations' reasons are things that could probably be prevented if they had more proper hygiene and better access to health care, and they are more of communicable diseases. The article also talks about the differences and similarities between health risks of low-income nations and high-income nations. For example, in high-income nations, people might be dying because they're chronically overweight and obese, and they're eating too much, they're not eating healthily. And in low-income nations, they're also dying from nutritional reasons, but it's more so because they're chronically underweight and they lack food, they lack the nutrition they need, and they end up dying from it because their body doesn't have the support and the strength that it needs. In 2015, more than half of deaths in low-income nations were caused by communicable diseases, maternal causes, complications, pre- and postnatal, and nutritional deficiencies, whereas in high-income nations, less than 7% of deaths were due to such causes. Non-communicable diseases caused 70% of deaths globally, ranging from 37% in lower-income nations to 88% in high-income nations. So you can see the difference between the cause of death between non-communicable and communicable diseases in low-income nations and high-income nations. Something that I realized as I was doing research on this topic is that there is a difference between low-income nations and low-income areas, although they're similar. For example, if you look at the Bronx, New York, that's one of the poorest neighborhoods in the U.S. And people there, I watched a documentary on it, an HBO documentary, and in that neighborhood, there's fast food options all around. They make deals on the fast food, like 2 burgers for $1 or something like that. And they don't have grocery stores nearby, they don't have markets. So they have to drive far distances to get there or walk really far distances. And for people who don't have vehicles to get there, it makes it very challenging. So they're obviously going to opt for the option that is closer, it's cheaper, it's easier, better access, more convenient. But if you look at an area such as Africa or areas like that, they may not be getting diseases from what they're eating, but they're getting diseases more so from water contamination, lack of food, transmitted diseases from a mosquito, like malaria, and they don't have the access to healthcare that they need. If they need medical care, they may not be able to get it. The hospital's hours away. They may not have money for the bus or the transportation to get there. And it makes it a big challenge because if they get a disease, sometimes they can't get the care that they need. They just can't afford it. They can't get there. It's not possible for them. So they end up dying from diseases that could be prevented if they just had access that we have here in America. BBC conducted a study on the Chimani people living in Bolivia, which found that they have the healthiest hearts in the world. And why would that be? Well, if you look at their diet, they eat things like rice, beans, freshwater fish that they catch, game that they hunt for, and they're obviously very active. They go and catch their game, they catch their fish, they're walking long distances, they're working, so they're very active. And if you compare that to the diet and lifestyle of Americans and a lot of people around the world, it's a big difference, because here in America and even other places, we consume high fat foods, foods that are high in cholesterol, oily foods, processed foods, sugary foods, all things that are major contributing factors to the chronic diseases and illnesses that are so prevalent in society today. And if you even compare that to other low-income nations such as Africa and things, like I talked about, their diseases are more so like transmitted diseases. They're from lack of hygiene. They're not very much so from their diets, because they also eat things like rice, beans. They're not eating foods that are oily and high in fat. And I think what society can learn from that is maybe we need to change our diet. And if we change our diet, we'll see a turnaround in many of the chronic diseases that are out there today.